Okay, thank you, and good morning, everybody. This is pretty similar to what we do every day with our call-ins to check in with each of the city departments. But we wanted to do an update that would be taped to broadcast for our people on Channel 15, and they could watch it on at home to see what the city is doing. But I think the bigger message here is that we're trying to do in practice what we're asking every one of our citizens in the city of Westfield and across Massachusetts and, of course, across the country to do. And that is practice social distancing to an extreme. I mean, we're here in City Hall, and we've actually closed the City Hall for a couple of weeks now to the public. But even among City Hall workers, we're trying to make sure that we keep a very, very healthy distance out of respect for each other's health, but obviously with a goal to try to flatten this damn curve and make sure that this disease does not spread. And I want to say thank you to all the people of the city who have been so good at doing that up until this point. We didn't want to speak down to anybody from the very beginning. We thought we were talking to a group of adults who would understand the seriousness of this problem. But now we're several weeks in, and we still have an issue with cases in Westfield and across this Commonwealth. And so I think it's time to start stepping up our rhetoric and saying to people, stay home, follow the protocols. If you are sick, don't go out. Wash your hands repeatedly and lengthily. Do it constantly. It is the one thing that we prove that we know works to kill the bug, right? Stay away from other people. And the biggest thing we're finding is as the weather improves, people are considering this some sort of vacation. And guys, it's not. As much as I'd love to be outside playing golf or taking a hike or going into the park, we can't do that anymore. We need to give ourselves the time to keep ourselves apart to make sure that this virus doesn't continue to spread. You'll hear from the emergency management director in just a few minutes and from our public health director, and you'll see the number in Westfield has grown again today to 81 positive cases in our city. And we don't want to have that. Every case is a person. Every person is a family. Every family is a group. And we don't want to expose any more groups of people in our community to this disease. So I'm asking you again, in the firmest terms possible, to stay home. Keep your distance. Wash your hands. If you're sick, get help. But stay away from other people. It's that important. And we're going to be taking some steps that we'll probably talk about on this conference call today with respect to shops like Walmart. You've heard what the city of Chicopee did the other day. We're going to do the same thing here in the city of Westfield. And we're following the guidelines set forth by the CDC and also by the Department of Public Health here in the state of Massachusetts. So you heard probably the governor just yesterday say we're looking now at May 4th. And hey, folks, we don't even know if that's going to be the end date. So we're planning for the long haul because we need to make sure we get this thing knocked out and taken care of because we don't want to continue this into June and July and the summertime. So I apologize if I have to be a little more gruff than I've been in the past. I thought it was important to be soothing and calming and tell everybody that we had this. But you know what? We won't have this without your help. So do what your friendly government folks are asking you to do in this case because it's what we need you to do in this strange and unprecedented time in 2020. I'm going to kick it over in just a minute to Joe Rouse, our Department of Public Health. But I want to say thank you to the people that you'll hear in this conference call because these are the warriors on the front line in Westfield, at least, that have been working on this issue now for over 3 weeks. And every single one of them is up to the task, whether they're public safety officials or whether they're working in our schools or whether they're serving our senior citizens. Every one of them have the idea in mind to try to take care of the people of this city and our first responders in the best possible way. Help us help them. Thank you. Hey, Joe, I'll kick it over to you at Public Health.
All right. Thanks, Mayor. Just want to give, I know there's going to be a lot of questions about our numbers, so I'll address that first. And just to say that a couple weeks ago, we decided to put this number out to be as transparent and honest as we can with the people of the city. And so with that, it's kind of, I think it's gotten a lot of attention because not a lot of other communities are doing the same thing with the same regularity. So in essence, it may look like our numbers are out of whack or excessive in comparison to neighboring communities, but I can tell you that I just got off the phone with the assistant public health commissioner at the state, who assures me that our numbers are not only in line with what they would expect to see at this point in the development of the disease, but also consistent with the more accurate numbers of our neighboring communities based on a similar size. So again, like I said, I wanted this number updated every day, regular basis, not sporadically. We did see a huge spike today, our biggest yet so far. But again, that's not just exclusive to Westfield. That's happening all over the place. So just for the record, communities, local boards of health are not required to share this number. In fact, the state Department of Public Health prefers that local communities defer to the county level numbers rather than the specific cities and town numbers. But again, we've decided to divulge this, and it's not out of whack or, in excess of any other similar communities in the state or in our area. And so that's, the state right now is seeing between 500 and 800 cases a day. So, we're up, I can't remember what the last number was, but over 20 in one day. So that's just a portion of what the state sees. So that's all I will talk about the numbers. I'll take any questions if anyone has them. Other than that, to just reiterate what the mayor said is that, we're constantly out there giving the message over and over again about the preventative measures and definitely the staying home. There's 4 different tips that I try and disseminate to everybody who will listen, and that is, Mayor touched on most of them. Wash your hands, stay home if you're sick, and do the social distancing. We like the 6 feet of space in between people, just to prevent any sort of contamination from droplets in the air of sick people. And then also, again, just stay home as much as you can. So, if you can abide by those, yep.
We're going to hold questions from the media until everyone's spoken. So when you wrap up, we're going to continue through the list and hold the media till the end, because it'll be hard to contain that and keep control of the meeting once we start that.
Okay, thanks, Jim. Yeah, that's it right now. I mean, we continue to do case monitoring for all of these 81 cases that we get. We're in contact. We're quarantining people. It is under control as much as we can right now. We're getting some assistance from the outside from some school nurses who volunteered to help us to try and keep up on all the cases. So as far as that goes, we're very much in control of it right now. That's all I got.
Joe, that's what I was going to ask. Do you have enough assistance to do the contact tracking that you need to do with each of the cases?
We do right now. We've also been offered just today when I talked to the assistant commissioner at public health at the state level. He offered assistance also.
Oh, very good.
So we can draw in volunteers from the state agency if we need them.
Thank you.
Okay. I'm the next up. This is Jim Wiggs, WIGGS, Westfield Emergency Management Director. And after I am done, it's going to go to the fire department. So Chief Egloff, be ready you're on deck. I just got a few words to add, and again, we're going to hold questions till the end. And then before I turn it over to the media, I will circle back to Mayor Humison and also to Representative Velas. So that way you've got the full context before we go into any questions. So please make notes as we go through for questions, and I think most will probably go to public health. So what I've been doing, and I've had some assistance from our public safety dispatch director, who you'll hear from in a bit. I've had a lot of help from her as we share a building. But what we primarily done, I have partnered with Joe Roush in the public health department to co-lead this effort. Joe is 100% focused on the public health side of it. I am focused on helping with operations such as supplies, outside assistance that we can get. Volunteers that want to assist by donating things for our assisted living facilities, long-term care, any type of donations that do come in. When early on we ask for some things, we've got a lot of donations. We will continue to take donations. If people have them, they can reach out to emanagement@cityofwestfield.org. Again, that's emanagement@cityofwestfield.org. And we will provide guidance. They can reach out on Facebook. They can also call this number 568-1222, and we will provide some guidance on how they can get items to us. But basically, what we've done, we've been receiving supplies from MEMA as the departments reach out and they need supplies. We've been getting what we have for masks and gloves out to the departments, sanitizer and other things, so they can continue to operate. I can't go into details about how they clean their vehicles and stuff. If those questions are at the end, and or the various departments, police and fire, can talk about what they're doing for precautions. But I give them the necessary supplies. We also track things. I do host the daily conference calls that we have to pull together the departments so we know the state of where we're at and what we need to do to respond. One thing I do want to tell people, I want to reemphasize the social distancing and stuff, but nowhere's along the line, and I want people to be very patient with public health, because no one outside of public health is aware of those numbers until they are released. I don't ask. I don't want to know, and it's not something that we need to do to operate. And if people are not taking this serious when the number's at 81, then in their head they can make up a number, and whatever it is that they can put a number inside their head that they will take it serious, because they need to take this serious to keep that number as flat as possible. We do not want the number to go up even by one, but if individuals do not take this seriously, we're going to be in the same boat as other communities. So stress that they do the right things and they do it every day. You're going to see on Facebook shortly, if it's not already been posted, even handing out supplies that when officers come up here to receive them, we're taking the necessary precautions and stuff. So please take heed to this. If I can ask anything of the media, it's to remember the elderly, and Tina will speak more to that later. Remember your long-term care facilities and assisted living facilities, or anyone that the hospice groups or anything that may need something. Ask them also, can you have donations? But we are talking to them. We do have a conference call with the assisted living facilities in the city, and we're doing what we can to help support them until their vendor supplies come through. So with that said, I'm going to turn it over to the fire department.
Hello, this is Fire Chief Patrick Egloff with the Westfield Fire Department.
Hey, Chief.
First, I would like everyone to know that the Westfield Fire Department continues to go to all calls, both emergency and non-emergency, for both fire and EMS without interruption. It remains extremely important that citizens of Westfield only call the dispatch center for actual emergencies. The ambulance service needs to remain ready for calls involving COVID-19 that need hospital intervention. The more calls that first responders go to that do not involve an emergency, the likelihood that they may become infected goes up. Now, not all COVID-19 calls need to go to the hospital, and the majority of cases will be mitigated at home. The fire department is a family of people separate from their own families. In our professional family, we currently have 5 first responders that have tested positive for COVID-19 that are either quarantined or have recovered. I anticipate that this number will fluctuate as the pandemic plays out. This is why it is imperative that citizens only call us for actual emergencies so that we can do the greatest good while protecting our responders from harm. I have recently been put with a mutual aid agreement with the towns of Agawam, East Longmeadow, Ludlow, Southwick, West Springfield, and Wilbraham, along with Westfield, that allows us to go and use resources, and the most important resources is our people, to go and, in case a fire department were to go and be decimated because of this pandemic, that we can go and share personnel. That for the media that's on the call, that press release will be put out later today by Agawam Fire Chief Al Saroy. Currently, our equipment and supplies, we're currently pretty good when it comes to supplies, PPE. Vendors continue to be slow in getting the product in, but people are donating PPE such as face masks and gloves. And we're also been getting donations from the likes of Home Depot and other businesses. There was an article in the Westfield Evening News that we had 4,000 masks, and this is not true. We have a fraction of that amount. We are working closely with emergency management and the Hamden County Fire Mutual Aid Association, which is apprised of all the fire chiefs from Hamden County. We're working with a vendor to secure PPE for all our departments in order to be prepared if things take a turn for the worst. Access to our building has been closed to the public for regular business, but remains open for emergencies. No public is allowed into the building. The temperatures of all employees are taken at shift change and before they come in the building. Our fire inspections have been stopped in accordance with Governor Baker's declaration. Lastly, the citizens of the city of Westfield can help the fire department by staying home, using social distancing, and only calling in emergency situations. Please call your primary care physician first before calling for the ambulance. Thank you.
Thanks, Chief.
All right, Police Department. Hi, Jim, can you hear me? Yes, sir. Hi, everybody. Good morning. Chief Valier from Westfield Police Department. First of all, we continue to operate with public safety and services our priority. Our staffing is up to full strength, except for one. Yesterday, unfortunately, we got our first positive test. So that's concerning to us. It's not, we weren't naive to the fact that this was probably going to happen here. There's a number of other departments, Northampton, Springfield, that have significantly higher numbers, and I would expect at some point that's going to change for us as well. As Chief Egloff said, human resources are really what we need to make sure we can keep adequately staffed. So our focus really right now, while our call volume is down, is on employee wellness and the ability to maintain critical operations with potentially a staff reduction. So at this point, we are in the think tank putting together a new strategy for redeploying our personnel, creating more separation, more time off. And other than that, our biggest concern really is about our numbers potentially growing as far as people infected with the virus. Thanks, Chief. And next is Public Safety Dispatch, and it will be followed by the Community and Schools team.
Hi, good morning, everyone. Mayor, Jim.
Hi, Nina.
My name is Dana Barsh. I'm the director of the Public Safety Dispatch Center in the city. My team of dispatchers are the ones who answer your 911 calls and send the Westfield Police fire personnel, EMS personnel to all of your emergencies. And if you've ever called 911 ever, you probably had the dispatcher ask you a series of questions, and you've probably wondered why. And one of the reasons for that, actually there's several reasons, but one is because we're trying to gather as much information as we possibly can in order to send the proper response for the type of situation that you're calling about. And the first responders need to know exactly what's happening in the emergency so that they can provide the best help they can when they get there. And the other reason is because whatever information we give to the first responders may help them stay safe on scene. So with the coronavirus, the COVID-19 outbreak, that's no different. So if you have to call 911 for anything, you may have the dispatchers ask you their typical series of questions. And now we are also screening any call that comes in that's medical in nature for any symptoms that are consistent with COVID. And again, that's for the dispatcher to decide what to send for help and to keep our first responders safe. But like Chief Egloff said, please don't call 911 unless you have an emergency. That's really important. And along the same lines, if you're not calling in a medical emergency, the dispatchers won't ask specific questions of you to screen for symptoms of COVID. But I do urge you, and I can't stress this enough, this is to help us protect our first responders. Please offer up information that if someone there, either yourself or someone else in the house or the place that you're at, is experiencing any flu-like or coronavirus consistent symptoms, please let the dispatcher know. Tell the dispatcher, and they'll pass it along to the first responder so that they don't have to go in without proper personal protective equipment. And then also you may have the dispatcher who's taking your call ask you to either meet the responder outside or at least to the door of the house so they don't have to go into a home when it's not completely necessary. My last piece as the lead on the communication team for emergency management and working with Jim Wiggs is I just want to push it out to the citizens to use online resources as much as possible to get your information. The city's website it's updated frequently. It has a lot of great information on COVID-19, especially from your city government. The webpage, if you don't already know it, is cityofwestfield.org. And if you are on Facebook, I strongly suggest that you follow Westfield Emergency Management on Facebook. That page is updated almost daily with articles. Jim Wiggs, the director, has sent out and written heartfelt messages to citizens. And also any new information that we find to be helpful to citizens is going out there as well. So again, that's Westfield Emergency Management. Thanks, Mayor, for giving me the time to speak.
Thank you, Nina. Appreciate it.
All right, community and schools.
Hi, this is Superintendent Zaporowski. Can everybody hear me?
Hi, Stephen.
Yes.
Hi, thank you. So I want to update a little bit on the school piece first. We have received guidance at the end of last week from Commissioner Jeff Riley of the Department of Elementary and Secondary Education. So Westfield schools will be moving to a remote learning plan that will begin effectively April 13th. We have actually sent the plan out to staff for their review now, and it'll be coming out to parents later today, and then principals will be following up both with families and with staff members. Next week, we are distributing Chromebooks to families that need them, as well as musical instruments, so that the students that are in band will be able to continue to practice. But again, our remote learning starts officially April 13th. In the meantime, we are continuing our enrichment activities and review of previously learned material. The school department continues to offer breakfast and lunch for students at 4 sites in the city: Abner Gibbs Elementary School, Franklin Avenue Elementary School from 11 to 1 for the rest of this week. Abner Gibbs will be moving to the middle school starting on Monday. And then we are also, and that's, again, those are 11 to 1. And then we also have lunches and breakfast at Powder Mill Villages and Colonial Pine Apartments from 11:30 to 12:30. And again, what happens is the student picks up a lunch, and they also have enough for breakfast the next day. Again, anyone with questions on that can reach out to our food services department at 572-6493. We are averaging about 750 meals a day. We are also collaborating with the Westfield, or the Boys and Girls Club of Greater Westfield for free curbside meals for youth ages 2 to 18. These are grab and go, and also these are Monday through Friday, both of the meal distributions. But for the Boys and Girls Club of Greater Westfield, they are at they're offering it at West Silver Street from 4:30 to 6:30 at their actual physical location, and they're doing grab and go meals from 5 to 6 at Franklin Elementary School and Colonial Pine Acres here in Westfield. And the Boys and Girls Club is averaging about 275 per day. I also want to say there are an average of 40 meals per day, Sunday through Friday, at the Soup Kitchen. I know that there are some extra meals that are given to Our House and the Samaritan Inn. And that is all that I have right now, except for, the Senior Lunch School program. Seniors can actually grab lunch as well at Abner Gibbs and Franklin Avenue Monday through Friday from 11 to 1. The Westfield Soup Kitchen Sunday through Friday from 5 to 5:45, and that is the corner of 101 Meadow Street and White Street. And then the Senior Center itself is doing takeout meals prepared by the Senior Center kitchen staff. They are available for $3 Monday through Friday, and again, that is curbside pickup. They just ask that folks who want to order a meal call the Senior Center first at 562-6435 in the morning between 8:30 and 10 to provide a name and a phone number, and that way their meal will be available for pickup that day between 11 and 12. If there are any questions, please feel free to reach out to me.
Okay,
Thanks, Devin.
Tina,
You're welcome,
Tina,
Mayor.
our senior center, Tina, go ahead.
Okay, thanks. Tina Gorman from the Westfield Senior Center. I'm director of the Senior Center. So as Stefan just said, we are offering meals on a daily basis. We've seen a tremendous jump in the number of meals that we've been doing curbside pickup. In a week and a half, we've gone from 40 to over 100. So that's where we are right about now. As Stefan said, folks need to call the Senior Center at 562-6435 between 8:30 and 10. And then curbside pickup is from 11 to 12. What we're hearing from the seniors, and of course a lot of the seniors that are utilizing this service are seniors that normally would have participated in our congregate meal program here at the center, and that is obviously no longer available to them. But what we're hearing from them is two things. One is that by doing it this way, it's keeping them out of the grocery stores. So they're feeling that this is a much safer way to get their food. And the meals that we're doing here are regular dinner meals. So it's kind of soup to nuts. And then they just, have something light in the morning and then light at night. So that's working out well for them. Other thing that I'm hearing from the seniors that are coming through is that they are doing exactly what Mayor Humison suggested. They are sheltering in place. And this is pretty much the only time that they're going out during the day. So this is their only human contact. And so I think they really appreciate that, but they can do it safely. They don't get out of their car. We are keeping a safe distance. We continue to change our protocol even for the meal pickup so that my staff remain safe and so that the seniors remain safe. We have, really appealed to the families of all of our seniors in the city to, step up to the plate and help out and do the grocery shopping for your loved ones who are older. We have family members who are coming through our line to pick up meals for their parents, and we really appreciate that. They just let us know when the senior calls in. They'll say, my son or my daughter or my grandson, whoever is going to pick up the meal for me. That's great. We have some of the seniors that are picking up for each other so that it's fewer people out and about. So that's been working out really, really well. Additionally, most of my staff is still working either remotely from home. We have some here. We're fortunate to have a relatively new senior center with a lot of space. So we have a lot of offices. Most of us have private offices, so we can definitely keep our distance. We are working to coordinate grocery shopping and pharmacy deliveries for as many of our homebound seniors who don't have family in the area as possible. So we've really been able to work with local pharmacies and local grocery stores to get home delivery for those folks set up. So that's working out really well. My senior benefits coordinator, Karen Noblet, is doing all of her Shine meetings over the phone. And if necessary, she's mailing out information to people because some of this is hard for them to understand without face-to-face contact. Lastly, I just want to touch on the last service that we're offering. I think we are the only senior center in the area at this point that is we have continued to run our medical equipment loan program. We're finding that this is more important than ever because some people who had planned surgeries with knee replacements, hip replacements, and so forth, those have all been postponed, and these people now are getting pretty desperate for wheelchairs and walkers to carry them through that time period before they can have surgery. So we are continuing to do that loan program. We pretty much, all the exchanges are done outside. Any equipment that's returned is returned outside and sanitized before we bring it in the building. And I've had an offer from the Amherst Council on Aging to give us some more equipment because my inventory is running low at this point. But I think that's important for people to know that as well. So if you have a need, please reach out to us. The telephone number at the Senior Center is 562-6435. Someone is generally in the building Monday through Friday, 8:30, generally to about 4 o'clock. We are asking if people have special needs to call us before 1 o'clock. So if it's something that we have to coordinate or get information on, it gives us some time, rather than getting an emergency phone call at 4 o'clock in the afternoon. So that's it for me, Mayor, and thank you so much for this opportunity.
Well done, Tina. Thank you.
Thank you, Tina. And before I turn it over back over to the mayor, I just want to add one thing. Joe Roush and I, for Public Health, we have formed an ICS structure. Several of the people that are talking today are at the leadership level of our ICS structure for managing this, but there's many, many people behind the scenes and a few other people. We're covering our finance areas, our procurement, logistics, everything we need to. So Joe and the first Public Health and the first responders have everything they need by just reaching out. We have all those things in place. So there's several people that are supporting police and fire and public health and finance and procurement and logistics and the mayor's office and everything, so we can run smoothly. And I don't want those people to feel slighted, but we didn't have time for everyone to speak today. And with that, and that includes like DPW and the airport and Bay State Noble's partner and everything. So there's a lot of people helping us, and I don't want them to feel slighted because they're not speaking on the call today. With that said, Mayor, I'm going to turn it over to you, and if you want to call on Representative Vilas, please do so. And then when you're ready, sir, you can open it up for questions.
Very good. Thanks, Jim. Representative Vilas, are you there?
I am. Can you hear me?
I can, John. Go ahead.
John Vilas here, State Rep Westfield. Just real quick, want to bring something else up from a different hat that I'm wearing right now. And an observation I had the past couple of days, yesterday and today. I got tasked for a couple of days with the Army, and one of the things that I'm seeing, and I guess this is something to be directed or just to kind of put on the radar for police and fire, is that, there's folks that are getting mobilized, both in the Guard and both in the reserves. And one of the things that many of us kind of identified yesterday is that you've got a lot of people, a lot of people that are in police and fire, public service-oriented people, are also in the reserves of the Guards. And a lot of these folks who are by day police officers and firefighters are getting mobilized. And in some ways, that could be a problem at some point in time, because it's great that they're getting mobilized, but they're getting pulled from their roles in their day job. So it's something that we're having these conversations. Obviously, different. Like if you're in the Guard, obviously you're reporting up to the Baker administration here in Massachusetts. But like for myself and the folks that I'm dealing with, you're dealing with big Army, and that's obviously your bosses are not our, your commander in chief is the president. So I guess the point I'm trying to make is that if that is a problem you're confronted with, this is a conversation we're starting to have, and the problem obviously being that your ranks are being depleted because the Guard and the reserves have called them up. And that's certainly a conversation we can have offline. Now, kind of going back to my job as a state rep in Westfield, I guess what I would say is that obviously we've got these daily press conferences where Governor Baker, per his state of emergency, is really taking the lead on so many issues out there. That being said, it would be remiss to think that the legislature is not doing anything that they've been elected to. Just by way of example, in my personal life, my professional life, I have never been as busy in terms of phone calls and emails from constituents in Westfield and beyond. Anything from unemployment to small businesses who are being decimated by this process. So to all of my constituents, our constituents out there, we're hearing with you loud and clear, and I'm certainly available 24/7 to process these things. But kind of as a big picture member of the legislature, we kind of collectively view our role in this is, to deal with what we're doing right now. Public safety of our constituents is what is absolutely paramount. But separate and distinct from that, I really think you're going to see the legislature weigh in on the recovery component of this. Our economy is being absolutely decimated by this, in any number of sectors. Obviously, hospitality, obviously all of the businesses that are considered non-essential. And as everybody can imagine, there's this trickle-down effect, this domino effect. And what I would say is that look at the legislature to weigh in heavily with both legislation, both with the budget, and all those things. So that's really what I got. Thank you.
Thanks, Representative Vilas. I appreciate that. And I think people watching this today can appreciate just how unprecedented these times are and how unusual it is that we had a press conference in an empty room. But we are again practicing that social distancing that we ask all of you out there to practice. And I think the biggest story this week that we might reference right now is the number of deaths at the Holyoke Soldiers Home that touched, I think, everybody in this valley, everybody in Western Massachusetts. What an awful thing to have happen. What an entirely preventable thing. And that's what we're trying to avoid now. Any more things like that going on. So you can help us in this community. We want Westfield well. We want Westfield well. Do your part and make sure you do everything you can so that we keep those numbers, as we start moving them in the other direction and move them down. Hey, Jim, how do we want to do the press questions? I know Sarah's right here in the room with me and she's got a question. Do you want to cut to her?
Hey, how about the person? Let's let the person in the room go first.
Okay.
And then I'll go down my list and stuff. If the other media will please listen to the question being asked, so you don't ask the same question, and please identify yourself when you ask a question. Was it Sarah in the room? So
yes.
Sarah, identify yourself and you can ask the first question.
Hi, this is Sarah from Western Mass News. I had two brief questions. I first wanted to see if there was any confirmed deaths from coronavirus that you've seen.
Can you hear the question, Joe?
Yeah, sure. I can say that I'll tell you what I know. One is that there has been confirmed deaths in Westfield. And the problem is that I can't give you a number because we don't get directly notified of that through our state reporting system. We just get the confirmed cases. We only know of one because we were trying to do some follow-up, and that individual had passed away. So that's the only way that we found out about that one. So any other numbers I can't speak to because it's not something that we routinely get. The state does get those numbers, but they don't pass them along to us because that case just winds up going out of our workflow.
Thank you, I appreciate it. My follow-up question is, there was mention that 5 firefighters tested positive and 1 police officer. I wanted to see how you were tracking where these officers and firefighters went and maybe how they were in contact with the virus, if you know of an exact person.
Chief, do you want to talk about that?
This is
Wait,
Chief
hold on,
Egloff.
hold on. Every question, let's route it to Joe, and then Joe route it to, if he wants the departments to answer that, please.
Very good.
Okay, yeah, I'll let Pat talk to that first as far as the process, but just to, a little note on that beforehand. If it's a person, firefighter or police officer that's a Westfield resident, we actually do all of that case investigation and then would give information to police and fire as they needed, as far as if we thought there was any persons of interest in the department. So outside of that, if it's a non-Westfield resident, I'll let the chief speak to that.
Okay, Chief Egloff here. So we have put some guidelines into place here at the fire department. Everybody coming in the door has their temperatures taken, but if they end up getting signs and symptoms of COVID-19, they call into the fire department, use the chain of command. We work under the ICS structure, and if they show any signs and symptoms, especially a fever, we send them over to get tested. We're luckily one of the fire departments in the area that is approved to get first responders tested. We put them out automatically, quarantine right away, and then we get them tested over at Bay State Medical Center, and then we end up getting, between our health department, Joe's office, and our office, and the HR director, we get the results back, and then we put them out for a certain period of time. We follow CDC guidelines and when they can come back to work. As for how they contracted it, as far as I'm concerned, I assume they did it through involvement with patient contact.
Okay, thank you.
You're welcome.
Okay, the next person that I had on my list was Dennis from the Reminder.
I don't have any questions.
Thank you, Dennis. I had Hope from the Westfield News.
Hi, my first question is in a follow-up with the Holyoke Soldiers Home. Are there any additional measures or anything else being put in place with Westfield as far as nursing homes, assisted living, in light of what happened there? Are there more strict things happening?
Joe, do you know the answer to that question off the top of your head?
Yeah, so in the health department here, we're working our public health nurse with Jim Wiggs from Emergency Management, so I'll let him talk to what they've been doing with that.
All right, perfect. Each week, as you recall, we did an initial reach out with the Deb Movana from Public Health, and we reached out to the assisted living facilities, the long-term care facilities, and we set up a call with them, and Deb has spoken to them directly about what they need to do, answered a lot of questions they had on their guidelines, and we meet each week with them in a conference call, and they have our direct numbers in the event they have any questions, and again, if they are running low on supplies and we get donations that we can share with them. So we are touching base with them on a regular tempo, and they have the direct lines to speak to us if something comes up in between those calls.
Thank you.
Did you have another question?
No, that's okay. I'll let somebody else go.
Okay. I will go to the Republican, and I believe we got a couple of people on from the Republican. I believe it was Bethany If you want to start out, Bethany, and then if you want to call on one of your counterparts, if they have a question, we'll go to Republican.
Sure, it's actually Stephanie. Thank you.
Oh, my bad.
No, that's okay. There's a lot of people on the call. So I have there been any indications, whether anecdotally or statistically, that there have been cluster outbreaks among groups or neighborhoods in the city of Westfield?
Yeah, good question. So what we're doing right now is we're mapping all of our cases and trying to figure out if there's a commonality. So what we're seeing right now, and it was very surprising, we don't have what could be considered any cluster cases. What we do have is we have the larger number of our cases concentrated into the more densely populated areas of the city, as you would imagine. But we are seeing it spread out. I keep saying all the way from, the northeast corner of the city to the southwest, and we're a big city square mileage wise. So it's really kind of very widespread. Right now, we don't have any data to suggest that there's a cluster necessarily, but we're hardly done with this. So, we're on the rise of the curve and not at the top yet. So we're still charting that, looking for that commonality.
Okay, and I just had one, pardon me, follow-up question to Western Mass News question about deaths. So I understand that the state is not routinely providing numbers on deaths, COVID deaths, but do you know, will they refuse to provide that information? Do you have any plans to press on that front, informational front?
I don't know if they would refuse to give that number. I have never asked, and I don't know what we would even do with that other than just for, curiosity of people. That number doesn't mean anything to us. We have active cases of people that we need to prioritize. So that is a good question, though. I don't know if you were to ask the state if they would release that. I don't even know if that's a public record that can be released, but so far we haven't requested that.
Okay, thank you.
Welcome.
Do we have someone else on the Republican that has a question?
Yes,
Yes,
Unknown
this is-
Mirabelli. Oh. I defer to Cynthia.
Cynthia Simison. I just have a follow-up to one of Stephanie's questions. So when you are mapping these cases, do you talk to or gather information about where these people have been, whether they were in a large group settings? What sort of information do you get from individuals of their particular circumstance so you can track that?
Okay, yep, that's a good question. So briefly, the process when we get the report of a confirmed case in Westfield is that we immediately try to contact the confirmed case, so the resident, and try and do an investigation on who their contacts were, their living situation, how many people in the household, and who could have been a significant contact, their work situation, again, also to find out who could have been a close contact, because what we're concentrated on initially is to make sure that we quarantine the contact of someone who had significant contact with a confirmed case. So that's what we're looking at as priority number one. Let's get that done and have those people be removed from being out in the public. So there is a whole investigation that goes with that. Now, I can say, I think I know the direction you're going with the question is to say, can we do this investigation more in depth to try and figure out if, all of these people shopped at the same store or all of these people went to the same gas station or something like that. We don't necessarily get that specific. We do have general demographics of people that we can say, their nationalities or that's all indicated on the form. So most of it, what we see right now, it's more of I think the spread's a residential issue right now, because of course we're seeing numbers in areas with higher populations like apartment complexes. Does that help?
It does, thank you. I had muted my phone, so thank you very much.
Okay, do we have another person from the Republican? If not, I'll move on to the next news group.
Yes, Manon Mirabelli. Besides Bay State in Springfield and Bay State Noble, do you have plans of opening up any other testing centers?
In Westfield right now, we don't have any plans of doing that. I think there's the Bay State Urgent Care Facility on Union Street. I don't know if they're already doing it. I think they may be. So there's that. Other than that, I mean, the city, as far as trying to advocate for more testing sites, we haven't gotten there yet because we just haven't been given the necessary supplies that we would need to do that. It's a possibility, but right now it's not something that's realistic.
This is Cynthia again. Just one more quick question, maybe for Jim Wiggs. Have any sites within the city, you know, I'm thinking the Air Guard, the Armory on Franklin Street, have any of those sites been looked at as potential treatment areas, housing areas to deal with this long term?
The answer to that question is working with MEMA, because they at the state level, they have basically the control of their those type of facilities and stuff. But yes, they are looking at various options for state-owned facilities and also even privately owned facilities. There are several things that they're taking a look at, and as the municipalities weigh what their needs are, and they are made aware of what our needs are, they will be assisting those efforts. At the same time, keep in mind that there will probably be some when you start looking at the Guard facilities, as the Guard is ramping up to assist us across the Commonwealth, their facilities will be needed as well, and as their guardsmen become in more contact with the public as they're assisting, they may need those facilities for themselves. But your short answer to your question is yes, they're being looked at. But the other answer is they're looking at other options as well.
Anything on the immediate forefront? Any specific places?
No, specifically, no. Right before this call, I had a conversation because we're playing out a scenario now that if we get to the point where we need some private separation for our personnel, to separate them from their family, or take care of another population, then we're looking at what the guidelines are, and we will be seeking Mass Emergency Management Agency's advice to understand what we can do and what we should do. But we are discussing those things in the event they're needed. And until Public Health, which I'm in constant contact with, basically says that we need to move forward with our plan. It's just that, a plan, but we will not invoke our plan until it's deemed necessary.
Thank you.
Okay, I will move on. I have 22 News down on my list. 22 News.
Hi, yes. Yeah, this is Mike Mascadrelli here.
Go ahead, Mike. We can hear you.
Okay, great. So I guess our station, we just had some viewers who are wondering, I don't know if this question has been asked already, but we were wondering if there was any public gathering event that is being blamed, which could have led to an increase in cases. We heard from some rumors and some viewers about a church service that was held over the weekend that shouldn't have been held. I don't know if there was any truth to that, or if there was any other events that you guys noticed where a virus could have been spread at.
So, okay, I'll answer to that, and I can say definitively that any report of any sort of gathering in the last 2, maybe even plus weeks, in a situation like that is total rumor. And I can say that definitively because we had been hearing the same thing, and so the mayor can probably address this as well, but being in contact with the churches in the community to encourage them, to not be having congregations of people. I mean, it's across the board with all the churches, but for some reason, reports still started to come in from residents saying people were still ignoring what we were saying or what the governor was saying, and found out that was not true. We did ask the Westfield police to keep an eye on some places like that, as we do with other places where there's people congregating even in city parks, and have had no reports recently of that being a fact. So I don't know, Mayor, do you want to comment on that?
No, you're right on, Joe. I mean, we're very concerned about rumors impacting any segment of our community. Obviously, if the issue were true, we'd want to get on it right away. But Joe's right. We actually asked the police to help us out by checking out any reports, and they came back and verified that those reports were false. So the rumors persist, sadly and unfortunately, but they haven't been proven true, and that's good news.
Okay, great. Thank you.
Okay, is there anyone from the media that I missed? Chamber of Commerce was on. Did you have a question, Chamber, for anything for the businesses? We would appreciate also the support from the Chamber to remind businesses to, if they're not essential, make sure they stay closed. If they are open or essential business, follow the guidelines as much as possible.
So, Jim, go ahead.
Yep, go ahead.
Well, thank you for giving me the opportunity. So, we are encouraging them to always follow the guidelines. However, I would like to just add a comment. If any of the agencies, the city agencies or services have links or contact information, I'd like to get that information out, because I know I have a couple of chamber members that want to make donations. So, Jim, I took down your information for the donations that you might be able to help, or could use. So I'd like to share information as well to the chamber members, but also just to let you know, a lot of our micro businesses, the very small businesses, this is a very grim situation. So we're really focusing our efforts right now in trying to get them assistance. I'm assuming you may or may not know, but I'm on a weekly, sometimes bi-weekly call with Lieutenant Governor Polito and Secretary Keneally and Secretary Acosta. So we are getting weekly up-to-date information as well. So I'd be glad to keep anyone in the loop if they want to know anything. We are a resource for the business community. So thank you for your time and everything that you're doing. Thank you.
I appreciate that. And Peter Miller is helping us. And what I'll do is I'll reach out to Peter and we'll set up a time, because I would also like to speak to you about some things. But in respect for Peter, since we asked him to take the lead on this part, I will work with him and through him. But thank you very much. There are some things that I think it works both ways, that you can help us with, that we can help you with.
Great. Thank you.
You're very welcome. Okay, one last call out to the media. Does the media have any additional questions at this time?
This is Stephanie Barry. I just have a quick question in terms of the employees at City Hall. Have there been any confirmed cases, and what are you doing to keep the employees there safe?
We have a good answer for that. Joe, go ahead.
So I you know what? I don't know how to answer your question. I almost feel like it may be a slippery slope. I can say that if we did have a confirmed case at City Hall, we had no exposures to any of the employees, and that everything had been disinfected and just by coincidence, as a matter of fact, after the fact. So I don't know if I'm at liberty to confirm that because of confidentiality, but I can say that, there was, as far as the employees are concerned in City Hall, there weren't any known exposures.
And I would just add to that, what we're doing, what we did from the beginning for our employees, we have split shifts. We immediately we actually, we did a thorough cleaning of City Hall in the beginning as we started locking down City Hall, and we split shifts and greatly minimized access to City Hall, basically closed it to the public. And people are able, when they come into the offices, they are able to social distance. We have our tech center has set up dozens of allowing people to remote access where they can continue to do their job on the days that they're remote. So we have done a lot to not only City Hall employees, but to all across the other buildings. We've worked out contingency plans that are legal by their contract, legal by their unions, meet the guidelines of HR, and we can continue running our city. And that was the part I said we have a good answer about, not getting into the particular for one person, but we're doing a real good job of keeping the city running and keeping our employees as safe as possible when they do come to work by the separation and having cleaning supplies and things on hand for them in the office.
Okay, I appreciate that, and there may be a nuance that I'm missing. But so you delineated a few numbers of first responders, police and fire, who had tested positive. So I guess I'm just unclear about where do you draw the line of, while not naming people, obviously I know that's not compassionate nor possible under HIPAA. I'm just confused as to why you would tally up police and fire and then it would be a confidential matter for people who work at City Hall.
Well, I didn't say it is a confidential matter. I said I'm not sure if it is. I'm not comfortable right now because of the isolated case giving that information. If you want to check back with me, I can get confirmation as to whether or not I can give that out to you.
Okay.
So I think that's fair enough, right?
Yeah, definitely.
Great. Okay.
And so just that form that you referred to when you do the investigation, is that something that I can have a copy of? Is it public record? Is it online somewhere?
I missed the word. The what that we refer to?
The form that you refer to when you're vetting cases, just asking standard information to just draw out more information about how folks may have been exposed. Is that a public record? Is that something that I could have access to?
That's another good question. You're really trying to trip me up today, aren't you?
No, I'm not. You've been very nice.
She's just doing her job.
Yeah, no, that's good. And so another one I have to check on that as well. So
Okay.
I don't want to ruffle any feathers on it. So maybe we should chat offline afterwards, and we can set that straight.
That'd be great. Thank you.
All right, thanks.
All right, we're basically at the 1 hour mark. Unless there's something the mayor wants to close with, I'll give the mayor the opportunity to close because we've got to get back. We got to get some of these people back doing the job that they need to do.
Well, Jim, I'd just like to say thank you to everybody who participated today in the call and who participates each day in helping to keep the city of Westfield safe. Thank you to our media partners for coming and actually covering this unusual press conference. But I think it, again, reiterates the need of people to stay distant from one another, to stay safe. And that's what we did here with our press conference, and that's what we hope everybody will do going forward until we lick this bug. So thank you again, everybody. Have a good afternoon and stay well.
Don, this is Cynthia. Thank you all from City Hall and around the city for sharing this. It's been a wonderful experience for us. Thanks.
Thanks, Cynthia. It's good to hear your voice.
You're welcome. Bye. Thank you.
Thanks, everyone.